While dry cough and sneezing, fever, and difficulty breathing are the most common symptoms associated with COVID-19, there are persons who may be infected with the disease, but because they are not showing any symptoms, are walking around and going about their regular lives whilst unknowingly spreading the disease. This process is known as viral shedding and is most prevalent in children and young adults. Dr. Shamdia Prasad, Chief Medical Officer, during a recent interview with Nightly News, disclosed that a number of asymptomatic cases have been registered.
Well, we have identified positives from among contacts and they have not displayed any symptoms. So I would say yes, we have recorded asymptomatic cases. We have, of course, a large group of numbers of persons who tested positive, became ill and had to be attended to. But we do have persons who have gone through the entire period of the beyond 14 days without developing any symptoms, but they were tested positive.
The Chief Medical Officer provided insight into how this category of persons can pass the virus on to others.
Unfortunately, most of the research is indicating that those persons can still carry the COVID-19, but also transmit it to others, right? Through, normal breathing, through their breath, through speaking, little sprays that emit from our respiratory system here and there, And even healthy people, sometimes they inhale a bit of fume or dust. They might cough spontaneously. It doesn't mean they have a cough, but they might cough as a reaction to being exposed to a noxious something that irritates the nose or the respiratory tract. All right? I would say that person is symptomatic.
The Ministry of Public Health, after revealing challenges with underreporting of COVID-19 cases due to the stigma, has since begun rapid testing for the disease through the launch of its mobile testing units at 3 locations across the country. The Chief Medical Officer is once again calling on Guyanese to remain at home as much as possible and to take all the necessary precautionary measures if they have to go outside. These include wearing a face mask, maintaining physical distancing, and the heightened use of sanitization products before and after touching surfaces. As of April 26, there were 74 positive COVID-19 cases in Guyana with 8 deaths. The 8th person who died at the Georgetown Public Hospital was 45-year-old Lennox William, who lost the battle while receiving treatment in the COVID-19 intensive care unit. Temika Rodney reporting for the HGP Nightly News.